Hello, everyone, and welcome to another episode of the All Out Coach podcast. My name is Tim. I'm your host. This is your show and opportunity to advance ourselves and also our teams by focusing on the depth, the knowledge, and meaning from one conversation to another. Today, my guest is one of the most dedicated people that I know. She's a renowned leader in the world of pharmacy. Her name is Leigh Briscoe-Dwyer. I've known her quite a long time. She's currently the director of the pharmacy at the United Health System, a comprehensive healthcare network that includes many hospitals in Binghamton, New York. She's also the board member of the American Society of Health System Pharmacists, or ASHP. Throughout her career, Leigh has held many different responsibilities that spanned healthcare systems, such as her vice president role in the network of pharmacy at Westchester County Medical, her other administrative executive roles at the North Shore Health System, which is now called Northwell. She continues to be a mentor to pharmacists across different facets of this profession as well. The clinical experiences and responsibilities she's held, and also in the industry as well. Early in her career, she was the medical science liaison for Pfizer. I mentioned that I've known her a long time, and I've been able to reconnect with her now just recently. But what I find remarkable about her enthusiasm, her passion for the pharmacy is that after every single one of her presentations that I attended, whether it was at a national meeting or a regional meeting, I left them more inspired, more empowered about myself as a person, as a leader, as a pharmacist, and the unlimited potential that this profession, this trusted healthcare profession has. And so I'm particularly happy and truly privileged to be able to reconnect with you, Leigh, and to have some of your time with me here on All Out Coach.
Well, thank you very much for those kind words. It's a pleasure to be here and talk about, some of my favorite subjects, which are pharmacy and leadership and making a difference.
Sure. I introduced some of the highlights from your career, but I'd like to ask you to give your perspective of some of the biggest accomplishments in your career and also the direction and your inspiration currently, Leigh.
Sure. I always say that, pharmacy chose me. I didn't choose pharmacy. Pharmacy chose me. I had what you would consider to be a Cinderella career. To be able to sit at this point in my career and look back and say, every step that I've made in my career, I've been able to build on what I've learned before. But to sit here and say that I'm on the board of ASHP, that's a dream, and I'm still in the pinch me mode for that. It's hard to say that there's a highlight. I think that the thing that I love most is making an organization better, knowing that it's better when I leave it than when I got there. Having people identify that they are in fact really good leaders and to have them find their niche and to really see them grow and blossom in the roles that they have. And I think that the thing that I am most proud of is probably when someone comes up to me at a meeting, big, little, national, local, and they say, I remember you and I remember something that you said that still stays with me. I think that's my greatest accomplishment.
Were there some mentors that you aspired to early in your career that helped fuel that passion, Leigh?
Absolutely. I have said on more than one occasion that, I would not be sitting where I am today without Dr. Tom O'Brien, who was the director of pharmacy at Bassett Hospital when I did my internship hours there in my last year of pharmacy school at Albany. And, Tom saw something in me and kind of sat me down and asked me what my plan was. And I told him what my plan was. And he's like, yeah, that's not a good plan. He's like, this is where you need to go. This is what you need to do. And that included going back to school and making sure I got my PharmD. And he was the first person who got me involved in my local pharmacy organization. When as a student, he said, by the way, nobody make plans for tomorrow night because there's a meeting that you're going to be going to and I'm taking you.
Hmm.
It wasn't, do you want to go? It was, we are going to this meeting because it's part of your obligation.
Hmm.
And so, and I'm very lucky that that I can still reach out to Tom, and I still see him, and I still thank him profusely every day for helping me get on this path. And I think that's why I take mentoring so seriously, because I really don't know where I would be if I didn't have, somebody like Tom to help me, to get started, and to kind of keep me on my path. And I think that so it's one of the reasons why it's so important to me. And one of the things that I always talk about with students and with young leaders is, to develop that core group of people around you that you trust. Not a big group of people, but a very small group of people that you trust, that you run stuff by. So, look, I've got this opportunity. It's moving outside my comfort zone, but it's a great opportunity. I've got, I might have to move, I might not have to move, but, they'll give you honest feedback. And, because I think that sometimes, trying to look into a mirror, it's difficult to see, what your true strengths and capacities are. So you use that group, I call it your tribe. You use your tribe to help you make some of those decisions, and keep you on task.
Hmm. And you try to be, I guess, the best student you can be, right, of those mentors. Which,
Yes,
yeah,
yes, absolutely.
Leigh, we've made many advances in healthcare. We live longer than ever, yet a lot of disparities continue to exist among elderly, among many patient populations. I know you're very passionate about this. Can you talk about the disparities in healthcare currently, what your perspectives are on potential
Sure.
solutions?
I think that, the COVID pandemic really, I identified some of these disparities that we have in healthcare, because we saw differences in populations who both contracted COVID, and those who did poor versus those who did well, those who died versus those who didn't. And we're still kind of teasing out some of that information, but I think that those numbers are certainly valid. And kind of give us a target of, okay, so now that we're starting to recover and dig out, now we know what we have to do. I think that when we were able, for example, we were able to move to a lot of virtual physician visits, virtual education, which I think was great. It kind of showed that healthcare, which sometimes we think of as trying to turn the Titanic, right? We're actually a lot more nimble than we thought we were. But I happen to live in an area. I live in an area in upstate New York that's very rural. I've also lived in areas down in the
Yeah.
city, which are very, very urban, right? So, but I've always, my home and the place that I was raised is in
Yeah.
upstate New York, in a very rural area, and broadband internet is still not available to 100% of the people. And so I've had, I've had friends who've actually moved during COVID, because their kids were being taught online, and they didn't have internet services. They literally had to buy a new house and move there so that they could have good internet service.
Hmm.
I think we saw a lot of frustrations with people trying to get online to get to schedule an appointment for a COVID vaccine. Because if you think about some of those initial groups at the beginning, right? So it was people who were over 65, people who had a lot of concomitant disease states. Not a lot of those people, spread all over the country, had the same access to the means by which you needed to make an appointment. All the appointments in New York State were online.
Hmm.
If you don't have internet, you don't get an appointment.
Yeah.
And so, looking at, where I am in Binghamton and in Johnson City, we're doing a lot of outreach, because there are, in order to reach herd immunity for COVID vaccination, you need to meet a pretty significant percentage of the population. Not
Yeah.
all that population is going to come to you. You
Hmm.
have to go to them. So, we go to them for homeless, for homebound, for behavioral health patients. So we actually, we have to make that determination that healthcare is not always, people aren't always going to come to you in healthcare. You've got to do the outreach to them.
Yeah.
And I think sometimes it's difficult for people who live in a very urban area to realize that there's not a large chain drugstore, two stores on opposite corners everywhere you go. There are counties in upstate New York where there's only one hospital in the entire county. There are some places, where I work right now, where if you get a discharge prescription from an emergency room at 2 o'clock in the morning, it's a 20 to a 30-minute drive to get your prescription filled.
Mhm.
And so it's looking at those types of things that I'm actually interested in doing right now to try to figure out how we can bring healthcare to people, who are in more urban and disparate areas.
Yeah. One of the areas that I always wondered about, and I saw a gap in our healthcare, is the continuity of healthcare, and the medication reconciliation is how we refer to it in pharmacy, or how we used to refer to it when I was a student. And so, how do you standardize the highest quality of care across the different healthcare providers, systems, insurance plans, to make sure that the right patient gets the right care by the right provider at the right time?
Well, I'm going to preface this by, if I actually really had the answer to this this question, we
Yeah.
could be having this conversation on my private island in Bali. Okay.
Yeah.
But I mean,
Those are the
that
kinds
is,
of questions we ask on All Out Coach, Leigh.
so, being that I'm not in my private island in Bali, so I mean, that is one of the biggest issues that we have, right? Is health, even healthcare within a system is somewhat disparate, because, and I think that pharmacy has a significant role to play here, because pharmacy, I kind of look at pharmacy as the central warehouse, because no matter who the patients go see, their cardiologist, their gastroenterologist, their rheumatologist, their internal medicine person, if they're going to be getting a prescription from them, they all come to me. They all come to the pharmacy. So I think that, realizing that comes with some responsibility to say, okay, so I have this, this task now of not just filling what's in front of me, but making sure that it's appropriate in comparison with everything else that I know about the patient, that maybe some prescribers and some providers don't know. And that's where, again, medication reconciliation, or MedRec, comes into play. And then, I think that we've shown in a lot of different studies that pharmacists do medication reconciliation better. I think it's because of the fact that we do have we've got more of that information, but it's very time consuming. And it's not something that you can, that you can kind of spit out really, really quickly. And so I think that people who are really invested in fixing this problem and in making it better, they need to realize that it takes a lot of manpower and it takes a lot of time to make sure that we get it done right. And I think that the first thing about standardization comes with figuring out ways to have access, through different medical records, through different pharmacy records. I know in New York we have a RIO, which opens up some information to us, but I think that there's buckets of information out there, and we're just not good at capturing it and being able to filter it and figure out what some of the answers to the questions that we have are.
Yeah, and I have family members who have worked many years, at healthcare professionals themselves, whose insurance plans change, right, from one year to the
Every
next, and then
January.
they're able, and then they go through this delay in treatment that's critical for even cholesterol, for kidney disease, for hypertension, and I see them being, having to face a lot of problems that could be avoided with more continuous care. As a follow-up to the technology So pharmacists are also becoming
Well, again,
How do you think that the pharmaceutical industry can partner more? Leigh, you've had a very what You too, Leigh. Thank you so much.